Thank you so much, and I wish to recognize and stand on all the existing protocol as it has been observed since we started. I'm happy, and I wish to congratulate the Ministry of Health and your partners, Center for Health, Human Rights and Development, and all our development partners that have found it fit to support this second national conference on health, human rights and development in Uganda. I wish particularly to congratulate the Ministry of Health and your partners for specifically setting aside this conference to discuss the social determinants of health, a fondly neglected aspect of our health systems, and yet part of the philosophical foundations of health tells us that prevention is always better than cure. But more often than not, conversations about strengthening our health systems are always focused on the clinical and the infrastructure perspective of health. People are always demanding for health facilities, which is structural. They are demanding for health workers, which is human. They are demanding for medicines and drugs, which is the clinical aspect, all put together. And rarely do we discuss the social and the underlying determinants, of which if we could only address such, we are going to keep millions of people out of the health systems. Actually, the resources that our health system in Uganda is having currently now would be most sufficient for our health system if we could only address the social and underlying determinants of health. Our health workers will be spending a lot of their time in research as opposed to attending to us. This morning, I wish to address myself on only two perspectives of the social determinants or the underlying determinants. And the first of it is the politics. The politics of the day, the politics in the world that is causing a lot of anxieties and mental distress. And we all know how we are not doing well as a country in as far as mental illness is concerned. Official statistics tell us that 10% of the total population in Uganda currently, and far more than that, in one way or the other, are suffering a form of mental distress. And one of the drivers of this is the politics of the day. We all know what is going on currently in the country, how people are so stressed, how people are so depressed, and we don't know what is going to happen after that. So either as active political participants or recipients of the political decisions, politics is pushing many of us into the health systems. That is also accompanied with the economics of the day. So if we could only play our politics right, if we could only deal with our politics in the right manner, many of us may not end up into mental hospitals. I do work on food. I'm a food enthusiast, and food, you are what you eat. That is what we are told. What did you eat for dinner? What have we served our families? What are our children eating in schools? What are we eating? What we are eating is what is pushing us into the health system. Our health system is clogged by people because of what they have eaten or what they have not eaten. Look at the numbers of people with non-communicable diseases: pressure, hypertension, diabetes, cancers, and all those things. They are because of what we are eating. The sugar-sweetened beverages, the alcohol, the chemical residues in our foods. You know, it is what we are eating. The too much of oils that we are eating are the ones that are filling up the Heart Institute, they are filling up the Cancer Institute, they are filling up the Diabetes Clinic, and all of those things. Check the amount of money our country is spending on treating malnutrition alone. One child requires a minimum of $120, and we are having 26% of our children under 5, and 54% of the population that suffered stunting while they were children. The country is spending $254 million annually to treat malnutrition, foodborne diseases like diarrhea, and respiratory illnesses because of what is happening in our environment. This is all avoidable if only we could address what we eat. Therefore, this conference is not for the health workers. It is not for the medical doctors. This conference is for us food consumers. This conference is for the politicians. This conference is for our leaders. This conference is for our agriculture extension workers who are supposed to tell farmers which chemicals to use and how to use them. This conference is for the input dealers that are selling to the farmers chemicals to be used in our food system. This conference is for the food vendors in the market that add chemicals to our vegetables while they are selling them. This conference is for the market administrators. This conference is for our leaders in all our rights. Because if only we could sort out one thing, the food system, then the money our health sector in Uganda have today will be very sufficient. Please, as we deliberate for the next 2 days, remember, you are what you eat. Remember, it is very easy to eat right than treating when you have eaten wrong. Remember, prevention is better than cure. But also remember, one single apple a day keeps the doctor away. What if you have a health diet? I wish you great deliberations, and I continue to follow.